And welcome to the Chelmsford Medical Centre reception. Now I'm here today to talk to the cosmetic surgery team about any questions and perhaps concerns that you may have about breast augmentation and uplifts. We're going to be looking at the difference between the two procedures and finding out exactly what they entail. We'll answer previous questions asked by patients, look at some of the risks that are involved and see some client testimonials. Well, I've signed in, I've had my coffee, and now I'm off to meet Professor Frame, who's one of the cosmetic surgery team here at the Chelmsford Medical Centre. Professor Frame is Professor of Aesthetic Plastic Surgery at Anglia Ruskin University and is an Executive Committee member of the British Association of Aesthetic Plastic Surgery. He has over 25 years' experience specialising in aesthetic and reconstructive surgery. Hello, Professor Frame. Now, many of those watching will know the difference between a breast augmentation and a breast uplift, but just in case, can you tell me a bit about the difference?
A breast augmentation is where we enlarge the breasts, either by means of fat grafting, injectables, but most commonly with implants, breast implants. And a mastopexy or uplift is all about lifting the breasts and relocating the nipples, usually into a higher position, shuffling everything around and taking it away from a low droopy position into a more youthful positioning on the chest wall.
So how does the procedure actually affect the shape of the breast? I've heard a lot about teardrop or round. What does that actually mean?
I think the word teardrop was coined by a man in America, and it's put into the design of a certain type of implant where it's narrow at the top and broader at the bottom. And it's an implant which gained favour in the early 1990s, at a time when the silicone was causing a big scare throughout the world. That implant, as a shaped implant, has its uses, the teardrop shape, but it is prone to causing problems, not necessarily immediately, but later on. The teardrop shaped implants are actually prone to rotating, and if they sort of rotate through an angle, then it doesn't remain as a teardrop shape anymore, and if one rotates and the other one doesn't, you end up with a misshape and an embarrassment. In your clothes, they look completely wrong. Out of your clothes, they look a disaster. So there are times when the teardrop shape will work, and that is when you have a broad chest wall and a short height breast, because those oval shaped implants actually do look quite good when they use the teardrop prosthesis.
So I've decided to opt for a breast lift. What exactly does the procedure entail?
It depends again how we're going to do it. A breast uplift means you have to come into hospital and you often have to undergo quite big surgery. It's not usually painful surgery, I have to say, but there's a lot of moving around, and it takes about 3.5 hours probably to do a proper mastopexy. And I say proper because there are different ways of doing it. From a simple little operation where you just lift the nipple through an incision around the nipple itself and then make a bigger incision and just shuffle one into the other, that doesn't usually give a good long-term result. It usually means the breast will bottom out and fall down. So we then have to think in terms of a scar that goes around the nipple and then vertically down. That's called a lollipop scar. But for those with very loose skin, you actually have to make a scar that goes around the nipple vertically down and then horizontally underneath the breast, and that's what we call an anchor scar.
So the end results mean they'll be more even?
Yeah, with a mastopexy, you have the opportunity to equalise the breasts, either by augmenting the smaller breast with a little implant, or by reducing the bigger breast, and then doing the standard mastopexy, having done a little mini reduction. There is a new technique which we've had access to since last October called a brief-form mastopexy, known as an internal bra, and it's like a membrane that goes inside the breast, and it holds the boob into a position on the chest wall by stitches. You don't actually see this device, but it actually sits in your body, and it holds your breast there for the rest of your life. So 7 out of 10 girls, if you choose the right lady, won't actually need to wear a bra again for uplifting again. So it is actually quite a novel and very, very ingenious bit of equipment.
Can I expect a change in the nipple sensation? Will they be more or less sensitive?
Addressing sensitivity, they may be more sensitive for at least 3 to 6 months, what we call hypersensitivity, not unusual. And some girls have to wear little silicone gel pads inside their bra to stop them rubbing. That type of sensitivity is common for women get what we call jogger's nipple. super sensitive nipples. A fairly large percentage, probably around about 70 to 80%, don't have any change in the sensitivity, and the rest may lose it completely. So up to about a third of girls can lose it. Now for larger breasted girls with sagging boobs, generally speaking, I don't think anybody has ever said that's a sacrifice not worth making. For the very small breasted girls, it's slightly different. They seem to have this perception that you've got to have sensitive nipples, and it is part of the equation about the benefits and risks of proceeding with this type of operation.
I've not had children yet, but I'd love to in the future. Will I still be able to breastfeed?
With a mastopexy, it depends really how much operating, how much dissecting we do. If we're going right into the breast tissue and shuffling it all around, it's probably better to say you won't breastfeed. You will produce milk, but probably not enough to keep the baby going. If you do the breeform, we're not interfering at all with the breast ducts or the glands, and therefore you can breastfeed. With regards breastfeeding after breast augmentation with implants, you can breastfeed absolutely normally because we don't actually see any of your breast tissue. Implants are placed in a plane deep to the breast, which is either in that immediate plane from breast to muscle or actually behind the muscle. But at no stage do we see any breast tissue. Therefore your breast will engorge with milk if it can do that after you've had your baby.
With a procedure like this, will I expect to find some scarring? And if so, will it be visible?
The scars from augmentation and mastopexy are actually completely different. The augmentation, the scars generally speaking are best placed underneath the breast so that as the boob falls down you don't actually see the scar. It could also be a scar around or through the nipple to put an implant in. That's fine as long as you've got big nipples. For a girl with very small nipples, which generally speaking is what goes on, we'll talk about the areola, which is the coloured bit around the projecting part of the nipple. If you have a small areola, it's actually impossible to put these newer implants through a small hole without creating a lot of trauma, therefore we don't do it. You can have it put in through the armpit, particularly if the implant is going to go behind the muscle on the chest wall. But for today's girl that wears off-the-shoulder type clothing, if you're forming a bad scar and you start moving around, people will see that, and therefore it's not such a good idea. And in my experience, most people having that approach end up with an implant that's way too high on the chest wall, so they don't look good out of a bra. With a mastopexy, it's slightly different in that the scars are more extensive. They always go around the nipple, and it's a question of whether they go downwards and horizontally underneath the breast as well. And it depends what we're trying to achieve with the mastopexy as to which scar we would give you. Those scars are fine as long as we choose the right person. Now, most mastopexies are in women that have had children, where the skin is a little bit looser and it tends to fall down. When we're doing an uplift on that sort of lady, the scars generally do very well. Scars don't do well on girls that haven't had children, hasn't been stretched before. They're auburn, ginger-haired, Celtic origin, Mediterranean, black-skinned people. They don't do well with scars. They can form what we call keloids. And then the price to pay of a bad scar doesn't outweigh the benefit you're actually going to get.
So as you've explained, breast augmentation is when the implant's put just behind the breast, but I'm interested to know what actual materials these implants are made of.
Now, implants are made of different materials, and we have a whole range of implants at this hospital, from the standard silicone with a very fine texturing to the very coarse texturing ones, and then to having ones which are covered in a polyurethane coat. And as it turns out, those implants have a 15% better chance of not going hard than the other more conventional implants. So things have moved on. We now have better implants and therefore better outcomes with less risk. And the teardrop shaped ones have a place, but a marginal place in what we do for breast augmentation.
So you've mentioned fat transfer as an option. Why would I choose one as opposed to the other?
Yes, fat transfer is a fairly novel approach, and it's used for those girls that really aren't looking for a massive augmentation. They're not talking about a cup-sized variance from A to C or D, for example. You're talking about a means of just volumizing it to give you slightly more projection in a certain part of the breast, around the periphery or centrally, or to take up a bit of the slack where it's starting to give way. And it's a really good way of doing it because there's minimal risk, there's high reward.
So obviously the methods used are very different. How long could I expect each one to last? And with the fat transfer, is my body going to break down the fat in time? And maybe the implants, do you think they might need adjusting or replacing in time?
Two little questions there. An implant by and large, we think will last your lifetime. We hope it will, but we don't actually know. Today's implants haven't been around 30, 40, 50 years. But those that have now superseded the implants that were around in the 90s are better than the 90s implants, and we haven't changed those for anything other than they folded or they kinked or were causing problems, which is very infrequent, I have to say. So there can be material wear and tear, and they could rupture, but we don't go into this thinking we'll have to change them in 10 years, which is contrary to what the public think at the present time. So how long an implant will last, we don't know. Fat grafting, we think once it's in there, it's there, so it will behave like a normal fat cell. If you put weight on it, your breast will get larger. If you lose weight, the breast will get smaller. So to some extent, there's a flux that goes through your life, and particularly with pregnancy, if you do go pregnant, your milk glands will swell up and your fat will then be squished to the side and probably disappear. So when you then stop lactating, that fat, we have to encourage it to come back in, and it may not. So perhaps you would need further fat grafting later on.
So obviously cosmetic surgery's come a long way in recent years. How real do breast implants look?
Yeah, it depends what you're after really as a lady, because we see all sorts of different groups, you see. The 18-year-old to 20-year-old, we try and put off surgery until they're slightly more mature regarding their thinking, because usually they think implants equal bigger and bigger equals better, and they're using their contemporaries at school, if you like, who were large busted, who were the talk of the north, so to speak, but actually in real terms they're the ones that are going to want the reduction and the mastopexy later in life. But they're using the popularity of their friends to think big breasts are good news, but they're not, of course. So if you can get them over that immature phase and get them to university, and you know, there are obviously clearly some young women that are in desperate need of it. Young ladies of 18 with absolutely nothing, you know they're not going to do any breast development, and therefore we can help them. But for those that are vaguely immature, or we think are at risk, then we should put them off. So we get to the 20, 21-year-old bracket, and they've thought a little bit more about it, and they've seen their friends at university or college, and by then they really know why they want to do it. And they don't tend to think massive at that stage. They're tending to think of a more sensible breast size. And then if they're thinking in terms of not wanting anybody else to know they've had it done, then we have implants to suit. We have small implants. There are a group of young women, though, that choose to be professionals. They are croupiers, dancers, pole dancers, and their profession is all about how they look. And they can really progress well with the artificial look. Now, we don't like doing that, obviously, because we're forcing something which is very much normal. But on the other hand, it makes a huge difference to them as individuals, and it enhances their careers. And they feel that risk is worth taking. And I actually think that's not a bad thing. There are times when you have to then think in terms of what happens to them when they have their children and want to be made smaller. And I've been pleasantly surprised it's not quite as bad a deal when the implants are taken out. You don't end up with a loose skin syndrome in most instances. If you understand how the body behaves, taking the implants out in a girl with good skin, they can regress and actually look quite nice without needing any further surgery. And these are only put in through small little incisions, remember, so therefore the only legacy would be the scar.
Now I understand I'm going to have to wear a special bra after surgery, but how long until I can wear my own lingerie?
Yeah, the operation is you know, fairly traumatic. It's quite painful, and for those that have broken a bone, it's actually quite painful until you put the bone in a cast or the leg in a cast, and the same principle applies to breast augmentation. If you augment a girl's breast, it's painful. So we put you in a bra, which is what we call a front loader, with like a feeding straps at the front, and it actually locks you in. And in addition, we then put another binder over the top and what we call a stabilizer, which holds the implants into position. And those three things immobilize you. This hospital, you would then be thinking of going home later in the day. So in other words, it's done as a day case. And providing you know you're fit and well and healthy and you don't do too much on that first 24 hours, your risks are minimal. But you would carry the risk of bleeding, and bleeding means you have to come back in and go to the operating theatre. So you've got to go carefully for that first 24, 48 hours. So the bra stays on, as do the binder and the stabiliser, and then you come back to the hospital the next day or the day after, so the nurses can check out what's going on. And then the whole thing is reduced to leave just the bra only. Now this bra we want to leave then untouched for at least a week. And then you come back and they recheck, the nurses will recheck you to make sure everything's in position, you haven't got a massive bruise, you're not running any risk of infection, that sort of thing. And then the following week, you can then, at the end of that first week, you can then take your bra off and wash it. And then, without putting yourself back into your bra straight away, just wait for it to dry. And just put that bra back on again. But don't go mad buying bras, because they're about 80 quid each. And one bra will tend to do you for the 6 weeks, if you just be careful with how you apply it. Some people like a second bra, or a sporty type bra, and you're welcome to use it. But remember, you mustn't shuffle these things around too much. We're literally just trying to lock you on. We're not trying to lift you. So from the first 2 weeks to the 4th week after the op, we'll let you do a bit more. We can start doing gentle exercises, but nothing high impact. From 6 weeks onwards, you can do what you like. So with a bra that we're going to give you, we're talking about 6 weeks. With care, you could then use your racy underwear, but be very careful how those underwires fit, because the fuller you are, the harder it is to buy a bra without wires. That wire really has to fit you well. We're not asking it to push up anymore, because you're going to have the look without the push up.
So once you've had the surgery, how long until it's safe to fly?
Well, we look at this in 2 ways. If you believe everybody that's to do with surgery, they'll say you shouldn't really fly for 6 weeks after an operation. The issues aren't really quite as clear-cut as that, because a lot of my patients are actually airline hostesses, and of course they have to fly within 2 weeks or they lose their jobs. So they're up and about and flying. If you're flying short haul, you're probably okay. If you're going long haul, then it's a difficult answer. I'd probably say between 2 to 6 weeks, you're probably running a little bit more risk. But if you wear flight socks and take a small dose aspirin and that sort of thing as a prophylaxis, you'll probably be okay, providing you don't have gastric upset or you don't have a tendency to bleed or gastric bleed. So you put yourself at risk in other ways by doing that.
Professor Frank, thank you so much for spending time with us today, and I'm sure that you've addressed many of the queries that a lot of us have about these cosmetic procedures. Well, I hope that in the last few minutes I've managed to answer some of your questions about breast augmentation and uplifts and what you should expect from the procedures. If you've got any more questions or wish to see a consultant, call the number on your screen or check out our website for more information.